Hi there, everyone. I'm Dr. Andrea Schnowske from AlignLife of Peoria in the Metro Center, and I'm really excited because today, obviously you may or may not know me, but I'm a wellness expert and chiropractor, and we see patients of all ages in our office, and we help those that are struggling with joint pain, arthritis, even osteoporosis. And we want to help you not only get out of pain, but get you back on track to staying active so you can enjoy your life. So today I want to talk to you specifically about how you can help yourself. In this day and age, the medical community and just healthcare in general is overrun. A lot of times we're going to multiple specialists that may or may not be communicating with each other. So it's really important that you understand not only what's going on with your health, but also what you can do to, number one, help yourself, help your body heal better, help your body be able to bounce back and recover a little bit better. When we are looking at only using surgeries that they could literally change your whole entire life and really be detrimental, or even medications that have really harmful side effects, we want to know what other things we can do before that. We want to try to do as much as we can preventatively, conservatively, so that we don't have to undergo surgery or lifelong medication. So what I want to do today is talk a little bit more about aging, because we can age gracefully or we can age not so gracefully. If we think about age, it's really a number, right? But that number is only the number of years that you get to enjoy life, and we get to enjoy your present. So it's really important that you make those years count. If you start to feel pain and you have arthritis or osteoporosis, you need to realize that your body's trying to communicate with you. It's telling you you've got to start living your life and stop acting your age. So what I want to do today is I want to give you 3 tips on ways that you can help to, number one, stop acting your age, but we want to reverse that arthritis. We want to reverse that osteoporosis so that you can get back on track to health. So those 3 ways. Number 1 is getting rid of pain, which I'll talk about in a little bit. Number 2 is turning back time and trying to get our hormones on track so that we can catch up on sleep and catch up on living our life. And number 3 is pumping iron. So we'll talk a little bit more about exercise things and different types of exercise that can help us to actually stop that bone breakdown. And a lot of times, me may be saying, oh, I'm eating all the right calcium, and, my doctor has me on medication for that. But in reality, that is not enough. So we're going to talk today about those 3 things and what you can do for each of those to help get your health back on track. So let's start with number 1, get rid of pain. So back pain is the number 2 most common reason that people see their doctor. And here's the fact: when you go to your doctor's office, in many cases, they're trying to find out if there's pathology or fracture going on that necessitates a surgery or something that they can do with actual treatment. However, if they don't find a fracture or tumor or things that need surgery, a lot of times they're going to give you a medication for pain relief, or sometimes even a medication as a muscle relaxer. But when it comes down to it, we have to realize that most back pain is actually a mechanical issue. The joints are misaligned. We have possibly some cartilage wear and tear. We may have arthritis already started up. We may have issues with our ligaments and muscles being weak or damaged that could be causing that pain. And a medication is not going to fix that. A medication is a chemical, whereas this is a physical problem that needs a physical treatment. So if you were looking at bones and joints that are out of place, if we're looking at muscles and ligaments, then cartilage, it's not working properly. The only thing that we can do to actually correct that and get to the root cause of that is by physically realigning the bones and the joints, strengthening the muscles to keep it there. And then if we do have scar tissue within the muscles or ligaments, we need to actually release or stretch out and get rid of that scar tissue so you can get mobility back. So in our office, we focus on chiropractic, and we do gentle chiropractic. We don't do the popping, twisting. We do the nice, gentle chiropractic, putting the joints back in place. We give you typically physical therapy in the office. So we do ultrasound, massage if necessary. We may do some stretching and exercises with you. And then we give you a home exercise program. We want to make sure that not only are your joints in place, but your muscles know exactly what to do to keep it there for the long term. So we don't have to see you forever, and we don't have to see you as often as if you aren't getting that physical therapy along with it. But in order for us to get to that stability point, you need the joints in place and the muscles and ligaments keeping it there. So in addition to looking at the joint issues and some of those mechanical problems, we also look at postural issues, because if you are sitting at a desk or looking down all day, whether you're on your phone or reading a book or even doing some knitting or crocheting, that can cause wear and tear on the joints. So it's really important we understand not only how we could be sitting that could help to prevent damage, but also if you are sitting that way, what do you need to do to change it now so it doesn't keep causing damage? We also look at autonomic issues. So the nerves in your spine not only go to cause pain, but they also go to your organ system. So in some cases, we've actually seen patients that have had heartburn and digestive issues that are coming from their spine. So when we start focusing on getting the nerves and the joints working, they may notice their heartburn, the reflux improves. We have some patients that have IBS, notice their symptoms went down, it wasn't as severe. We've even had people that have had sleeping issues and hormone imbalance that we start noticing things work better when your nerves that go to those joints are working better as well. So we want to make sure as number one, we get rid of your pain, but also make sure we teach you how to keep it gone and keep everything stable for long term. The number two reason we talked about was turning back time. And like I mentioned already, that has to do a lot with your hormones. So when we were young, we had limitless energy. We could run around all day, go to class, and it seemed like we would never tire out. However, about 50% of adults report that they are tired not only throughout the day, but even all the time. So we have to realize that we didn't miss the fountain of youth. What we are lacking is we are destroying our hormones. We are destroying our energy production in our bodies due to our high stress, our poor diet, and our lack of sleep or lack of good sleep. So you can see when we have those issues going on that when our hormones are imbalanced, we can see painful menstrual cycles. We can see infertility issues. We can see mood swings. We can see low testosterone issues coming from issues with hormone imbalance. We can also see joint pain. When your hormones are off balance, your joints are very unstable. It's more likely you're going to injure yourself or have pain, especially if you're noticing that on a monthly basis. That may actually coincide with some of that hormone imbalance you have going on. If you're waking up in the middle of the night, whether it's due to pain or due to just waking up and not being able to go back to sleep, that's another sign you've got some hormone imbalance going on. Those same hormones also control our metabolism and our weight gain. So if you're gaining weight, if your metabolism seems like it's just off the charts, not working right, that may be because of a hormone balance too. And in some cases, we can even see weakened immune systems when we have hormone imbalance as well. So in our office, we look at diet and simple lifestyle changes that you can do at home to start helping your body to produce those hormones, balancing everything out. In some cases, if we've had damage for years or if we're not getting results with those, the next step may be to look at some lab testing. And we do typically a saliva hormone test so we can see what's happening throughout the day. So we know exactly if there's a specific time of day that you're struggling with. Because if we only do a blood test, which is a lot of times when we're looking at hormones, your doctor may have only done a blood test first thing in the morning, it may change throughout the day. So if we can look at that whole entire day, we may find issues that are subclinical, things that your doctor missed because they only looked at that one single point a day. So that's one thing we do in the office is, like I said, diet and lifestyle changes can be super simple, but in some cases, you might need more help. You might need lab testing to find out what's going on and what you need to do to get that back on track. And our number three thing we're going to talk about is exercise. So I say pump that iron, but it's not just lifting weights. When we are exercising, we don't have to go to the gym and, carry huge bars and dumbbells around. It really comes down to we have to build our muscles. Your muscles pull on your bones to make them stronger, but we also need to make sure we're getting enough protein in our diet. As we age, we lose stomach acid. So if you're not getting little bits of protein throughout the day, you may not be getting enough that your body needs to rebuild those muscles. So it's important to eat the right amount of protein, but also build those muscles up so that you can have strong muscles. And as we load our muscles and pull on our bones, your bones actually get stronger. So lifting weights can be really helpful. And you don't have to be lifting heavy weights. You can actually use your body weight. You can use simple sand weights that go around your wrist or your ankle so that you can add a few pounds of pressure when you're walking. But one other really easy thing to do is improving your posture. When you improve your posture and you put the weight of your body and your head over your joints, you're going to strengthen those bones by loading them. So some simple things that you can do to reverse bone loss and even rebuild those stronger muscles of bones are to improve your posture, which we give home exercises for that, but also making sure you're exercising and getting the right amount of protein. So if you're struggling with that or you feel like you've already done everything and you're just not getting results, give our office a call. For those of you that are tuning in and watching this video today, I want to give you an opportunity to come into our office for a free consultation. We're going to sit down with you. We're going to talk about what's going on in your health, what you've tried so far, if you've had lab testing done, what those show, or if we missed something, or maybe need to do some additional lab testing so that we can figure out not only how to get you out of pain, but how to get your hormones balanced and how to get your muscles and bones building up stronger so that you can live an active life and stay healthy and enjoy the rest of your life, no matter how gracefully or not gracefully you're aging. So give our office a call, 309-689-6200. We do have limited appointments available for that, so you do have to call by Friday at noon to schedule an appointment for that free consultation. If you call after Friday at noon, that visit's $100 out of your pocket. So make sure you call us, get in as soon as you can, or at least get on the schedule by Friday at noon. So you've got to call us, set up an appointment that works for your schedule so we can get you in and find out what's going on so we can help you. So thanks for tuning in, and hopefully you learned something today. If you have any other questions, you can also shoot me an email or even comment on this video and I will get back with you. So have a great day.